A very good afternoon to everyone. On behalf of Dr. K.K. Agarwal's Heartcare Foundation of India, I welcome you to the 72nd webinar. Dr. K.K. started this entire series because of his love for educating others, imparting knowledge, and really creating a platform where everyone could come and communicate, interact with one another, and learn something new. I think that was his life's purpose, to learn something new himself and to make sure that everyone else goes back with some learning from anything that they do. So the whole purpose of these webinars is that, and we continue to honor his legacy and continue the programs that he had started. Today is World Cancer Day, so we have decided to take a very important topic of palliative care for cancer patients and other patients. That is something that is overall, a need of the hour. The number of cases of cancer is increasing over the years. A lot of times, of course, there could be hereditary reasons, there could be genetic reasons, but there are also lifestyle related reasons for it. So we are going to have an expert to come and talk to us about this and give some takeaways and answer everyone's questions. Before I move on, I would like to extend a really warm welcome to our co-host for today's session. It's really an honor to have all of you people associate with us, and you have such a busy schedule. And it is definitely, I can imagine Dr. Agarwal asking and everyone agreeing, but for us to continue asking and for you to continue supporting us, it means a lot to all of us. So thank you for your support. Welcoming Professor Dr. Manju Chugani, Dean, School of Nursing Sciences and Allied Health, Jamia Hamdard. Thank you, ma'am, for joining us. Miss, we are welcoming Miss Simil Babu, Professor, Holy Family College of Nursing, Delhi. Welcoming Miss Kumajulu Apunamai, Tutor, Community Health Nursing, Faculty of SGT University, Gurgaon. And Mr. Sadaram Sarate, Assistant Professor, Charotar, University of Science and Technology, Gujarat. Thank you so much, everyone. Again, from the bottom of our hearts, we thank you for taking out time. And of course, to the lovely audience, thank you for joining us. Thank you for coming and listening. If you have any suggestions for future topics, if you have any questions, please do put it in the chat box and we will be happy to take it. I would like to invite Manju ma'am. Manju ma'am, if you can please say a few words.
Yeah, thank you so much for this welcome. And we feel same way connected and will remain similar way connected with the foundation as Agarwal Saab is there with us all the time. He is still with us, I feel. And you rightly said that his love or passion was to learn and to teach new things to the people and come to the rescue of people who are in problem, not having money, not having much facilities. So he was more interested in catering to these kind of groups and people. And for nursing, he has a concern and soft heart for nurses, and he always took them along. And we still feel connected and would love to be involved in further activities. We need to carry his legacy forward, and also nobody should feel his absence, because he has given us so much that we can cherish whole of our life. So that's just to remember Dr. KK Agarwal. And coming to today's session, as rightly said by Mrs. Naina Agarwal Ahuja, she is, let me introduce her also, because many people must be knowing about her, but just for the sake of today's session, and she will be acting as a moderator also. If our this speaker has not joined, first I would like to introduce our moderator. Mrs. Naina Agarwal Ahuja is a trustee of Dr. KK's Heartcare Foundation of India and the founder of Talking Point Communications, a leading integrated PR and communication agency in India, serving clients across various industries. And we have a very eminent person as speaker for today, speaking on palliative care for cancer patients. And as you all know, that we are here to mark the World Cancer Day, and we all should take pledge today to spread awareness about the disease and work on its prevention before it comes to the disease, and then after that is a palliative care. And we know that palliative care improves the quality of life of patients and their families who are actually facing a lot of challenges. And looking at the number, 40 million per year are in need of palliative care. So the topic chosen for today to mark this important day is very appropriate, because 40 million per year are in need of palliative care, and 78% of these patients are in low and middle income countries, and we are falling in that. And cancer is the second leading cause of deaths globally, and 9.6 million deaths as per the 2018 census WHO. The numbers are as per WHO census. And early palliative care also reduces the unnecessary hospitalization. And that period is the period when you need to give quality to each and every individual who is suffering from this problem. And we are in the era where we everyone is concerned about the quality of care, whatever is the disease, whatever is the condition, but the quality of life is very, very important. And palliative care is not only done by nurses. Today I have asked many of my paramedical students, I'm heading paramedical and rehabilitation sciences also, they have also joined. I said, because palliative care involves a range of services. It can be by professionals who are playing very important role, starting from the physician, nurses, support workers, paramedics, pharmacists, physiotherapists, and volunteers, and various NGOs works for social cause. So all have an important role. Everyone plays very important role. So we all have to come together to provide palliative care. Today we have as a speaker, we have Dr. Shashikant Saini, who is working in Bhagwan Mahavir Cancer Hospital and Research Center. And he is a senior consultant there, working in surgical oncology department. And he has done his MS, and also he has done his sirship and postdoctoral fellowship in surgical oncology from Tata Memorial Hospital, Mumbai, and Rajiv Gandhi Cancer Institute, Delhi. He has long experience of working in this specialization. 15 years he has been doing surgical oncology, and he has more than 3,000 major surgical oncology surgeries to his credit. And his special interest is in hepatobiliary and pancreatic surgeries, lung resection, esophagus surgery and staples, colorectal procedures with staples, minimally invasive thoracic and abdominal procedures, breast conservation with reconstruction, head and neck surgery. And he is working on enhanced recovery after surgery protocol in pancreatic and colorectal procedures. He has several publications in reputed index journals, and Best Oncologist of Jaipur award was given to him in 2014. An Icon of Rajasthan award by India Today Group in 2014 again, and Young JMA Achievement Award in 2010, and Young MPS Achievement Award in 2008 and 9. And he is a member of important organizations like ASI, IASO, IHPBA. And he is a known, very eminent speaker. And today, I'm sure that all of you are going to get benefited with his presence. But before going to the speaker, I would like to introduce other co-host. Miss Simil Babu, who is a professor in Holy Family Hospital. We have with us Abon Mai, Miss Abon Mai from SGT University, Mr. Siddharam from Gujarat, and they will be speaking with you for 2 minutes, I think, and then we'll go straight to the session by Dr. Shashikant. So over to Simil Babu.
Dr. Shashikant, the eminent speaker today, Dr. Professor Manju Jugani, Dean of School of Nursing Sciences and Allied Health Sciences in Jamia Hamdard, Miss Aboni, and Mr. Siddharth Sarate, the other two co-hosts. And very, very good afternoon to one and all present here, including, I think, many nursing personnel as well as other healthcare professionals, and students are also attending this session. So very relevantly, that topic for today is taken as palliative care for cancer patients. As World Cancer Day theme for today is close the care gap. That is what I have read. So it's my privilege to become a co-host again in Dr. K.K. Agarwal's Heart Care Foundation initiative. From the beginning of COVID-19, as Manjuma very well said, Dr. K.K. Agarwal has taken a lot of initiative to spread awareness related to COVID-19 and to teach the public. He was continuously taking sessions for different sections of the society, including healthcare professional, common man. Nurses were actively involved in arranging the sessions, and students and teachers, as well as the nursing personnel, especially for nursing community I'm talking, benefited a lot from here during the COVID period. At last, we lost him for COVID only. Anyway, I think it's our duty to continue his mission and vision. So we will, I just want to say that we all like to continue and participate in all the, or continuing his mission through Heart Care Foundation. So when we are talking about the Cancer Day, so as you know that cancer, you can say he is standing number one cause of death, or number one or number two in almost all the countries. The main cause of death is cancer. So there are a lot of prejudices or misconceptions, or lack of awareness is persisting in the society related to cancer. So in this time, as number of cancer patients are increasing, the importance of palliative care also is increasing, and it's a right for every patient to get quality care. So we are all waiting forward we are looking forward for a session and to improve our knowledge as well as our awareness itself, so that being healthcare professional, we will be able to provide or give our knowledge to the society as well as cancer patients in all areas, preventive, curative, promotive aspects. So thank you so much for including me also for this session, and getting me an opportunity to being a co-host. Thank you so much.
Thank you so much, ma'am. I think Dr. Shashikant is also here. Thank you so much for joining us, Dr. Shashikant. I know you have a busy schedule. I'll quickly call upon Mr. Sadaram to say a few words, and then I'll go on to Ms. Khima Julio to say quickly a few words, and then we can hand over to Dr. Shashikant for the topic for today.
Thank you, ma'am. Very good afternoon to everyone. Warm greetings from Manikarka Topawala Institute of Nursing, a constituent of Charlotte University of Science and Technology from Gujarat. I am Mr. Siddharam Sarate, working in the position of assistant professor. We are honored to be a part of today's event as a co-host with the Dr. KK's Heart Care Foundation of India, because they are known for such awareness services. And today we have World Cancer Day on the theme close the care gap. Create awareness. It's very important as cancer is second leading cause of death in India after cardiovascular diseases. And one of the important concern in this is care of palliative care of patient cancer patient care. So very rightly we have chosen the topic, and we are looking at the vitality of this topic. And today's event collaboratively we have organized. So without taking much time, because most of the co-hosts have spoke more, so I give over to Naina Agarwal ma'am for further proceedings.
Thank you. Can I quickly have Miss Kimajulio, please? Kimajulio, ma'am, please.
Good afternoon, everyone. Good afternoon. My name is Kimajulio Bonmai from ICT University under the Association, Wellbeing Association. And today we are very grateful to be in this part of event which is organized by Heart Care Foundation of India. And we are really happy to have you, sir, our speaker, Dr. Shasikan Saini, Senior Consultant, Bhagwan Mahavir, Cancer Hospital, Jaipur. And on behalf of ICT, we are very thankful to have you here. And we are really excited to share our experience and your knowledge. And I also would like to thank my all co-hosts to be with me at this event. And I hope this webinar will be benefit for all of us and to know more about the palliative care for the cancer patient. Happy listening are ahead. Thank you, everyone.
Thank you. Just quickly introducing Dr. Shashikant again. I know we've introduced him before, but he's got over 15 years of experience in surgical oncology. He's done more than 3,000 surgical oncological procedures. So he will definitely be able to add a lot of, share his experience and add a lot of value to each person here. We've got over 500 participants who've joined us today and who are very eagerly waiting to hear from you, sir. I know you had an emergency procedure, so really thank you from the bottom of our hearts, that you've taken out time to join this session on World Cancer Day. Over to you, sir. If you can talk a little about the topic for the day, which is palliative care for cancer patients, since that's something that's a very, very important thing, and a lot of increasing number of cases are coming up of cancer, and a lot of people need palliative care. So everyone here is very eager to hear from you. Over to you, sir.
Sir, unmute myself.
Yeah.
Yeah, good afternoon, everyone. And sorry for slight delay because I was operating and I have to come in between my case. So, hello. Sincere thanks to all of you to inviting me for this thing. So role given to me that some of queries from audience side or your side regarding cancer related issues, right from, you can say, causes of cancer or regarding investigation or regarding treatment part or something regarding palliative also. So whatever I have my, you can say, small knowledge, I will definitely share with you all. So any concern from audience or any of, you can say, if you have queries regarding the same, you are all welcome. So I'll try my best to answer you.
Yeah. So, sir, maybe we can start by, talking about what is the reason for the increasing cancer numbers in India? Is there a difference 10 years ago, what we used to notice and what we are noticing now in the total number of cases that are coming up, and what are the reasons for it overall, especially each one of us, you have a fairly young audience here as well. What are the things that everyone should be doing? And we also, this is being telecasted live across all our social media pages, so lots of people want to kind of understand what is it that we can do and what is leading to a rise in cases.
Yeah, you are very right that since last few years or even decade, the number increasing. So 2, 3 factors are responsible, and one most important thing I am also realizing in my 20 years of experience in oncology, like you all are doing this effort, so many other organizations are also doing this effort of awareness. So awareness is increasing, so more and more people are coming, you can say, front to getting investigated them and taking treatment. If I recollect my experience when I was in TMH or even I joined Mahavir Cancer, around 70% or 65% patients used to come in advanced stage of disease. I'm talking about on maybe 10 years or 12 years back. But now this number is going down day by day, and almost 30% or 40% patients are low now, means they are coming in advanced stage. So more and more patients or more and more families are coming forward to getting investigated to their relative or patient and willing to take the treatment. So one part is that awareness is there because of efforts of you, like you all are doing. All cancer institutes are doing regular screening camps and regular whatever social media or print media awareness. And another thing, definitely lifestyle. So most important thing is tobacco. In our part of world, not only in India, in our part of world, many Asian countries, the tobacco consumption is very, very high and is freely available. So, and is a proven cause for common cancers, especially head neck cancer and lung cancer. It may cause many other cancers also, but head neck and lung cancers are documented etiology, or they come number one, you can say, list in etiological factors of head neck cancer and lung cancer. So tobacco is definitely culprit. So somehow the everybody is aware, you can say, person who is eating also, person who is selling also, and even supplier also, and even government is also aware about this burden. But somehow the things are not coming together to stop the consumption or stop the availability of very freely availability of at least tobacco. So these are the 2 factors. One is increasing awareness, and another is you can say very huge consumption of tobacco products in our part of world. So these are the 2 factors I'll put in my list, why the cases are increasing.
Doctor, my next question is, how do you really, what are the symptoms that someone should watch out for? We do know a hereditary risk factor also exists for different types of cancers, and also there's a lot of stigma and fear associated to it. So how can they, everyone here as caregivers, as nurses, as healthcare professionals, help people in the journey to accepting a diagnosis of cancer or getting to that also? A lot of people may just be in denial about it. So how can each person here really get there to providing the emotional and the medical support that people may need? And how do patients know that they should go to the doctor at what point?
One thing I'll say, we all should try to convince or try to give message that cancer is a curable. Now, present scenario, the cancer is completely curable disease. So this myth should be out of from, you can say, general public or even paramedical or medical fraternity, that cancer is not like we cannot treat. So cancer is completely curable disease. But the point is that it should be detected with early stage, means treatable stage. So if you are talking about hereditary cancers, few cancers are definitely having hereditary incidence. So in female, if I'll talk, that the breast and you can say cervical or uterine cancer is definitely having hereditary incidence, and overall colon cancer is also having hereditary issues. So whoever having these type of or these malignant, unfortunately these malignancies in their family, they should be extra alert or they should be extra, you can say, careful regarding themselves. So regular checkup means it includes clinical checkup as well as few form of imaging or few form of investigation they should undergo. So if I'll talk about breast, so if someone first degree relative having breast cancer in their family, so those all females means first degree relative I'm talk, then sisters in you can say siblings means mother as well as the aunts. They should have every year checkup as well as mammography. So usually that procedure starts for all females around after 40 or 45 years of age. But in this type of situation where you are having first degree relative in your family, so this starts around 5 year, 10 years before of this routine. So they should start the alert after 30 or 35 years of age. So that the breast self-examination is also a very documented method. So clinicians, if you consult them, they will teach you how you can examine yourself, plus regular checkup yearly by you can say it may not require that you have to go to cancer hospital for the same. Any general physician around you, general surgeon, he can also do or she can also do the needful, and mammography also. They are the same. If it comes for the cervix cancer, the pap smear is a very good modality of investigation to detect early. And in colon cancer, they advise yearly colonoscopy for family members if you are having first degree relative, especially at early age, because most of the time the family cancers they occur 1 decade earlier in comparison to the general population. So these are the few cancers which have hereditary incidence. And if rest of the cancer, you're talking about symptoms, anything abnormal in your body, anything which is there, in spite of taking routine treatment, symptomatic treatment by your neighboring physician or surgeon or your family physician, which is not, you can say, coming normal, or which are they are not healing for 2 weeks, 4 weeks, you have done the whatever routine workup or routine checkup or routine medications, but still things are not resolving. It should make you alert. I'm not telling that patient now definitely having cancer, not like that. But those symptoms, any symptom is you can say worrisome. So no, few weeks, if not getting you are rid of those symptoms, you should be consult to next level of tertiary care or secondary care, rather than just sticking with your nearby. They have limitations in their, you can say, experience, availability of resources. It's not their fault that they cannot diagnose or they could not diagnose your severe disease. It's not their fault. Their experience is such, their resources are limited. So you should immediately consult your next level of healthcare, so things get diagnosed and you can get the your required treatment. So any symptom, any, but few of them I'll tell you. In if you talk about the oral cavity cancers, any non-healing ulcer for uh, 3 4 weeks, you should make alarm. Ulcer means breach in mucosa in oral cavity. Change of voice may cause your larynx issues, voice box. Okay. In females, any abnormal bleeding while you are having regular periods, even or once you have stopped the period, means post-menopausal. So any bleeding after that should make you alarm. Not definitely that you are having cancer. There are 3 4 regions of these things, but one of them is cancer. So it should make you alert. Any lump you feel in your breast while your self-examination, any abnormality if you are feeling in your nipple, it should make you alarm. It should make you alarm. You should definitely consult. As I am told you that in early stage, all cancers, whatever cancer in body, all cancers in stage 1 and stage 2, they are 100% curable, 100% treatable, but with adequate treatment. So early detection and adequate treatment is the bottom line. So awareness regarding your causes as well as your symptoms is must, and should not, one should not afraid of getting investigated, getting examined and getting treatment.
Sir, if you can also throw some light on people who are living with cancer, palliative care, as you know, a lot of people are also keen to know about that. We also, we have the entire healthcare fraternity from different walks of life here. So what is the important role of palliative care? How can each person here help the person in their emotional journey, whether irrespective of what stage of cancer they are at?
So yeah, these days, almost all cancer hospitals are having dedicated palliative department. Like we are also having Bhagwan Mahavir Cancer Hospital. Without that, you can say department, or without that facility, the treatment of cancer is incomplete. In you can say decade back or few years back, the palliative means nothing is possible when only we refer the patient. But now, not the things have totally changed. They also involved in whenever patient is curable also. So very important department, very important aspect of cancer treatment, right? They have not only pain. They previously that was that pain clinic is palliative, not like that. These days they are having lot of other aspects also, right, from psychological, psychiatrist, home care, pain definitely there. Other things are they take care of their nutrition also, so they all comes in that branch. So very important aspect. So we never felt that key patient is if not curable, that only required the palliative, not like that. Always whenever we have patients in our, whenever we feel in an early stage, we always take them in loop. They are always there to help us. So very important aspect of cancer treatment is palliative department. I'll not say palliative pain clinic. Previously that palliative means pain clinic, but things have totally changed now. So in every right from, you can say, while surgery also sometimes in post-op period we need their help in, you can say, psychological aspect. So dedicated they have psychology, like we are also having very good team we have. So it helps the patient as well as even family members also. So that aspect is there. Pain definitely, even anesthetists are looking post-operative pain, but sometimes we need extra help of them. So they're always there to help them. Home care also they provide. They goes once the terminal care then comes, they even visited the uh, home their patients, and they consult them, they whatever best effort they can do regarding their pain, their nutrition, their IV access and all. So they do. So very important aspect, very important. We should not never you can say discourage the patient to refer to palliative department or this particular aspect of cancer care. So very multiple fronts they are having, not only pain but multiple aspects are there.
I'd like to open up top to my co-hosts. Ma'am, if you have any questions, Sadharam sir, Manju ma'am, anyone has any questions? Okay, Manjulu ma'am, do you have any questions? Before I take the audience questions, I'm just opening it up. Manju ma'am, you're on mute.
Unmute.
Yes, sorry, you were on mute.
Okay, because from your side it was mute. I was trying to do it. So thank you so much, sir, for highlighting these two major causes you said. Coming to the cervical cancer, which is curable out of all these cancers, if we see, cervical cancer is the one where we can work more on prevention because it is completely we can prevent it, in fact. And a lot of things we are doing like vaccination and other things, but people are not much aware about the vaccination. And also for palliative care, the second question is, for palliative care, where all they can go for this care? Most of the places this palliative care is available in private hospitals, and 80% of the care is in private hospitals, but it's huge amount of money which they have to incur, and people are there, those who are not able to afford. For them, where can we refer them? One. And second was related to the cervical cancer. What do you advise us to do to prevent it?
See, you are absolutely right. The palliative department is feasible or possible only in the, you can say, multi-specialty or super specialty hospital. Very difficult to provide these services everywhere. So I don't know much how to answer your question this. So, but most of the cancer institute I know they are having, and most of the cancer hospitals provide these care. They may be free or like we are providing most of the things and at very reasonable this thing. But to making available palliative department in, you can say, every small place is not practical, not practical. So definitely for that they have to come. But as much as I know in TMH when I was there, and even in our hospital, if someone call them, definitely, if they are taking treatment from outside of Bhagwan Mahavir Cancer also, if they call them for help, definitely they visit their home, definitely by their own expense. Hospital is providing to and fro cab to them or personal vehicle to them, and whatever best they can do for that patient or family, they are doing that. They are doing within, you can say, permissible area of 20, 30, 40 kilometers. They are very regular basis, they get the call and they go. But to establish the things, you can say, at every place is not feasible, not feasible. But they are ready to help. So in my hospital, if any one of here from Jaipur, if in audience or this thing, or they can call them Mahavir Cancer, and whatever best effort my department they are ready to do, they are very willing to do. And if they can come to Mahavir Cancer, then the no issue, they are most welcome. They are most welcome anytime, any day. Our palliative department is working 24 hours. In fact, I'll say someone is there throughout the, because they have anesthetist with them in combination. So on one anesthetist or two anesthetists are always available around the clock. So they look after that aspect when dedicated palliative persons are not there. So they are most welcome if they wish to come Mahavir Cancer, or in Jaipur they are providing home care also. Another aspect, you are talking about cervical cancer. So personal hygiene, that's the one most important aspect of this, you can say, cancer. So we have to make aware to peripheral people or peripheral healthcare workers. So somehow, and a lot of organizations are these days coming ahead and providing personal hygiene required things to needy persons. So personal hygiene is very important. Vaccination definitely is very well documented. So the one should, but it's the before any sexual exposure. So when only it works. Age is not a criteria. Previously, the age was a criteria, but the bottom line is that it should be given before exposure. So age is not a criteria. So we should come ahead. We should, until unless we ourselves will encourage our daughters or our family members to take these vaccinations. So then difficult to spread the awareness. But definitely it works. Definitely it works. But not only vaccine, in combination of your personal hygiene plus vaccine, a lot of other issues you have to take care. Another thing, the regular screening comes pap smear, same thing around 40, 45 years age. So regular examination and yearly pap smear is very important to detect early, because in stage 1 and stage 2, again, I mentioned you, it's a completely curable, whether you have surgery or radiation, almost both are equally effective. But surgery is obviously main treatment, but even radiation also works. But again, detection should be early. So pap smear is very important. The symptoms alarming, as I already mentioned you, any abnormal bleeding while your menses you are having or after your postmenopausal, it should make you alarm. You should consult your, you can say, whether a gynecologist is okay. Need not to be rushed to the cancer hospital. So if some investigation they advise, you should go ahead and you should be ready that whatever that I'll face and I'll take the treatment. So these are the few aspects regarding cervical cancer.
One more question. I visited one of the university and they had a equipment where they said even if we put a drop of blood, we can see the tendency or the potential of having cancer. Is it readily available nowadays? And what is the importance of getting biomarkers tested? Is it going to tell us something about the potential cancer
Yeah,
cases, or
that
how is that?
yeah, that instrument you are talking, that is colposcope is there, hysteroscope is there. Obviously, they are there, but they are not available, you can say, everywhere. So simple measures, personal hygiene, pap smear anywhere can be done. Whether it's a lab is available or not to test that, but pap smear can be, sample can be taken everywhere. So that is it. So in especially countries like us, so making those scopes or those facilities everywhere again comes in practical. So they're definitely, like, we are also having that scope. So by we can underlie visualize the, you can say, cervical area or uterine area and something abnormal very early we can detect, and we can biopsy that or we can take sample. Definitely there, that instrument is there, definitely. And what was another question here? So yeah, so lot of, you can say, genetic markers are there to assess whether person is potential candidate for having cancer. Yeah, definitely they are there, but very, very costly, very costly, very costly. So we cannot offer everyone, since the healthcare is taken by individuals. Where countries where everything is taken care by government and they are insured, they are secured, where those things you can do regularly or routinely. But in countries like us, where I am paying for myself or family is paying for themselves, so spending 70,000, 80,000 rupees on those tests, maybe not practical. So, but definitely you can get yourself tested, especially if you are having some, you can say, risk factors like family history, as I mentioned in my previous answer. So those are the candidates to having those tests, and definitely we can detect whether someone is potential or someone is having how much risk of having which type of cancer. Definitely there, but very costly, very costly.
Yeah. In between, I will take one question from the chat box. One of our participant, Nazni Naz, is asking, Sir, can you please throw some light that what are the patient's legal rights to comprehensive pain and symptom management at the end of life? Okay. Palliative care, in a way, she's asking for what are their rights. Nazni is otherwise here also. If you want to clarify further, your question would be good.
Yeah, I'm not getting exactly what.
Yeah. नाजनी क्या सवाल क्या है एग्जैक्टली आप ये पूछना चाहते हैं कि उनके क्या अधिकार हैं?
Yes, ma'am. I want to ask what are their rights? They can ask for their right. I mean, the patient can ask for their own right at the end of life.
See, definitely, the thing is there. Sometimes we feel that patient is, in spite of doing best effort in palliative care, patient is suffering lot, and we can read on their face that they want to be get rid of their life. But still, in our country, that is not permissible. That is not feasible. But many times we discuss this issue with our palliative care department. What should we do? Because we also feel very bad for those, because even they are, you can say, having a lot of suffering, but still their brain is telling them that because of that, me or my whole family is suffering. They are spending a lot of money, and everybody knows that there's no cure for me, no treatment, but in spite of they are doing, and I am also suffering. My pain is not getting even lesser by in spite of doing. So we can read on his face or on a face that he or she wants to get rid of life, but that aspect is not clear in our, you can say, rules still. So we have to wait. But in many countries, this is there, that family or patient can give that consent that we are ready to for that point. But in our country, that is not still permissible, not permissible.
We don't have any. Right. Thank you, sir.
One more question is there that lot of nurses are attending this, sir. So when the patients are on chemotherapy, what specifically nurses should pay attention to when they are caring for this patient and the patient is on chemotherapy?
See, definitely in comparison to the routine, you're giving drugs, and if you are giving chemotherapy, lot of things you have to see, because in comparison to the routine patients, the immunity of these patients are low, so they are very prone to getting infection early in comparison to the normal patients or non-cancer patients. So you have to take care of that part. It's a very important part. So regular your hand cleaning is there before touching them. If any line you are touching or any line you're using for your giving chemotherapy, please take care of that line. Always means a non-cancer patient also you have to take care of those things. But if since you're asking me while giving chemotherapy what extra care you take, so one thing is that they are in comparison to less immunity is very low, so they are very prone to getting infection early. So very important aspect that you should take care of that. Plus second another thing is that their psychology also, immunity plus psychology, they are very low because family feels that their patient is not aware about their disease. But I'm telling you, 100% patients are aware that he or she is suffering from cancer. They are aware. Family feels that patient is not aware. Their feel good factor. Patient feels कि नहीं. Family knows that I am not knowing. So they give the false feeling of you can say sense. So but patient is always aware about his or her disease. So we should be slightly, you can say, much polite with them, or we have sympathy or empathy with them while talking to them, while dealing with them. So this gives them the extra hope of you can say care, that my treatment is undergoing, my pain is less, and I'll go through my treatment, because many patients required many numbers of chemotherapy. It's not a one course of treatment that he or she has to receive and complete. So minimum 6 cycles, many times 10 cycles, 20 cycles. So repeated procedure is there every 2 week or 3 week. They have to come hospital, get admitted, and same thing, lot of side effects. So counseling, not only doctor, very limited time we have. We have to consult each patient, but limited time is there with us. So that remaining part that can be done by you all. So we never take our nursing staff as a, you can say, paramedical or this thing. We always keep them as a family member, team member. We equally support them. You are also there to take care of the patients. We always encourage them. You are our, you can say, best supporting hands to treat our cancer patients. So please be on your toes while you are dealing with cancer patients. You are best supportive for them, because I'm see I'll give 5 minutes or 10 minutes to patient by seeing, but once the patient gets in the ward, you are there round the clock with them. So you should be more familiar to them. You should be more friendly to them. And cancer, it works, really works, really works. I'm giving you practical this thing, and this is even, you can say, proven in literature also, ki psychological support, sympathy, empathy, all whatever this thing, they works in cancer treatment. They works, definitely works in cancer treatment.
Question on the group is, I want, Priyasi is asking, sir, I want to ask you about active tumor. How much does it take to spread and its prognosis? For example, active tumor of the bladder.
Active tumor of?
Bladder.
Urinary bladder you're talking?
Yes.
Urinary bladder or gallbladder?
Priyasi, you want to ask your question? Yeah, urinary bladder.
So what is your question? How, see, no cancer as such has that speed it will spread. Again, I'm telling you, any symptom, like if you're asking me especially about urinary bladder, so most of the patients had history of hematuria, means blood in urine. So whenever this thing you have, or any person have, he or she should be alarmed. So not only bladder, this may be in the kidney cancer also, ureter cancer also. So comparatively, if I'll answer you, the bladder cancer is treatable cancer. One of the, you can say, if you talk about the cancer overall of body, so bladder cancer is one of the curable cancer if detected early again. So how early spread is difficult to say. Means any cancer, that how early it will spread. All cancers have its own, you can say, path of spread, own process, own speed of this thing spread. Most commonly bladder cancer goes in nearby lymph nodes, and then it goes to the lung or bone. So but speed is not mentioned anywhere in literature, that how fast it will speed. So you should not wait if you have any alarming symptom. The message should be like that: if any alarming or abnormal symptom, we should consult our family physician or nearby available healthcare worker.
Preeti Komal is asking what can be done in childhood cancer and how can the child cope with that much pain? What measures can be, the healthcare professionals take to ease pediatric cases?
Yeah, very common scenario, childhood cancer, especially they have blood cancers. So previously blood cancer means blood cancer, but not now like these days. Blood cancer, maybe you can say maybe 100 types of blood cancers are available. So as madam was asking, various tests are available, molecular tests are available to document which type of exact blood cancer is there to kid. And most of the blood cancers, fortunately, they have treatment. But the one thing is that all these cancers have very long process of treatment, very long. If you ask me, comparison to the adult cancers or solid tumors, so liquid cancer or blood cancers are treatable, because by doing molecular tests we can detect which type of exact blood cancer is there, and according to that, lot of drugs are available for individual type of blood cancer, and they really works. But the process is very long. Main thing is that lot of supportive care is needed. In addition, the 20% part is treatment, maybe less even, and 80% part comes supportive care. So that should be available in that hospital. Like most of the cancer hospitals have dedicated pediatric wards, AML wards, pediatric, you can say, labs. All things are available, like bone marrow transplantation and all. So treatment is available, treatment is possible, but until unless we get tested, we can do molecular testing. Difficult to establish exact type of blood cancer, and the center should have, in addition to treating the, you can say, blood cancer part or hematologist, the remaining required supportive care also. It's a long process in comparison to the adult cancer or solid cancer, but treatment is possible.
I'll take the last question since we are running out of time. Anjali is asking if a patient receives care from several healthcare practitioners, are all those practitioners required to offer information and counseling about palliative care and end of life? And what are the treatment options? So, should there be some training mechanism for each person providing care?
Yeah, that is there, and in fact most of the palliative departments running very regularly these, you can say, meetings or CMEs or conference. In fact, in our hospital also, maybe every 3 months or every 6 months, we call around 30 paramedical staff or 30 group of doctors, and we 1 day 2 day session is there dedicatedly to them, what they can do in limited options available or limited resources available. So definitely this aspect can help in the patient, needy patients, in a lot of way. So most of the more and more cancer hospitals or palliative departments should come forward, and like we are conducting very regularly CMEs for those paramedical staff as well as in fact doctors, and giving them proper training and course. This is certified course from Palliative, you can say, organization of India. So provide them all aspects, whatever sources available in their nearby, so they can do. And we even refer the patients. If we have records of patients and we have record of those doctors or those staff who has attended, we definitely officially refer the patient to them also, and with proper guidance ki what they have to do in limited resources available. So very important aspect. This is again, this comes in the awareness of the people.
Thank you so much, sir. I don't want to hold you up. I know everyone is short on time. We will take maybe another session on, to answer
Definitely.
questions. Can I have Miss Simil Babu? Simil ma'am, can you please give your vote of thanks?
So thank you so much, Dr. Shashikant Saini, Senior Consultant, Surgical Oncologist of Bhagavan Mahavir Cancer Hospital and Research Center, Jaipur, for taking such an interesting and enriching session related to the cancer and giving important messages like cancer is curable and palliative care is not only applicable for end stage cancer, it is very much applicable for all stages of cancer, including from the diagnosis itself. And also within short period of time, sir, you could cover a lot of the entire, maybe you can say different types of cancer, or how we can screen different types of cancers, causes, clinical manifestations, and management. Sir, it was really a comprehensive session, and we learned so many new knowledge related to this topic. So on behalf of organizers, then co-host, co-host, all the participants, I express our sincere gratitude for taking the sessions and answering our questions. Thank you so much, sir.
Thank you. Thank you.
I
Pleasure. It's my
also-
pleasure. Thank you. Thank you. Bye.
I
Goodbye.
express my
Bye.
sincere thanks to Heartcare for Dr. KK's
राजा
Heartcare
मोहित
session
क्या हो
for
गया यार?
providing us this opportunity and to listen more, and Dr. Manju Chugani and other co-hosts, Ms. Sapna and Ms. Saini, for arranging these sessions. Thank you so much. By hoping for a healthier, brighter, and world without cancer. Thank you so much.
Thank you. Thank you, everyone. Thank you so much.
Thank you, everyone. Thank you, my all students, all participants, then also all co-hosts. Naina Agarwal, this was our first webinar with you, and hope to have many such kind of webinars where most of the people get benefited and